Well, we start the hour in the DRC where the World Health Organization says that the Ebola outbreak in the Democratic Republic of Congo is not an international health emergency at this stage. However, the organization's emergency committee has warned that the threat of the disease remains prevalent regionally. The virus has so far claimed the lives of about 139 people.
This Ebola outbreak in eastern DRC was declared on the 1st of August this year. The World Health Organization now says the resultant health threat is largely a regional one.
We also considered that if a FIC is declared, that may have implications on travel and trade, and that actually might hinder the efforts of the response teams, and that might rather have a negative implication to the whole action to control the outbreak. And therefore, the emergency committee concluded that this is not a public health emergency of international concern.
The International Health Organization, however, continues in its efforts to fight and contain the disease in DR Congo.
This does not mean WHO is not taking the outbreak seriously. We still have more than 250 people working in DRC to bring this outbreak to an end. Although the risk of global spread is low, it remains very high for neighboring countries, and we will be vigilant and strengthen our response, and we will not rest until the outbreak is finished.
As you may have heard, in one of the provinces, the outbreak is pretty much mitigated. In another province, it's just flaring up, but the concentration of the response teams is now focusing on this new area. And so we do have some optimism that this outbreak, just like the one in May, will be brought under control within reasonable time.
The virus has claimed the lives of about 139 people. 215 probable and confirmed cases have also been reported. The Ebola outbreak, it was noted, could also spread to neighboring Uganda or Rwanda. Both countries are well prepared to handle such an eventuality. Wilkisanyabwa, CGTN.
Now, earlier we spoke to the World Health Organization's spokesperson, Tarek Yaserovich, to get more details about why the organization has categorized the Ebola outbreak in the DRC as only a regional health threat.
No, on the contrary, the response will be strengthened. We have seen the number of cases increasing in past weeks, and this is the reason why WHO Director General convened the emergency committee, because we were very worried, and we still are, by the fact that there are more cases, especially in the town of Beni, that there is an increase in number of security incidents in this city, that there's also instances of mistrust from the population to responders. So all that prompted WHO to convene emergency committee, and this situation is still there. So one of advice is that we need to intensify our response, especially in town of Beni, and for that we would need resources. And at the same time, we have to work on preparedness in the neighboring countries. One of the reasons why the emergency committee did not consider current situation as global health emergency is exactly that mitigation measures are already in place. The response is very strong and led by national health authorities, and also neighboring countries are working on a preparedness. However, the risk is high and the response has to continue.